In this skills video, I'm going to be doing the shaving a resident's face, nail care, denture care, and care for an unconscious resident. So for the shaving procedure, you're going to want to come in, you're going to knock, well, you don't come in first, you're going to want to knock. Come in, you identify yourself, you greet your resident, you're going to explain the procedure that you're going to be doing, and you want to make sure you provide privacy and wash your hands. Then you're going to raise up the side of the bed that you're going to be working on because you want to perform good body mechanics so you don't hurt yourself. And then you're going to get all your supplies and put them on the over bed table. And I don't have anybody to show this on and don't really have the person to do that, so I'm just going to kind of run through and explain and show the materials and kind of demonstrate. So you're going to want to lay out all your supplies, and then there'll be a disposable safety razor, shaving cream, a washcloth, towel, and then a kidney basin. And we didn't have any kidney basin, so a bath basin. And we don't have any after shave, so I just used lotion. That's what we use in our unit. So you want to put all that supplies on the overbed table, and then you're going to put on your disposable gloves because you want to follow the bloodborne pathogens, because somebody gets a nick or a cut and that could be a bloodborne pathogen issue, so you want to make sure you wear disposable gloves. And then you're going to put your resident into a Fowler's position at about a 45-60 degree angle, the head of the bed. You're going to put the bath towel like this over the resident's shoulders, but that way you don't get any shaving cream or anything like that on them. So you're gonna put that on them like that. I'm just gonna kind of leave it here for demonstration. And then if they have any dentures, you want to go ahead and take those in and put them in their mouth. I'm gonna go ahead and put those in and help them with that. And then you're going to wash, use warm water and a rag and your soap, and you're going to wash their face. And then don't dry their face because you're going to shave their face, so you're just going to wet the washcloth, wring it out, and then you're going to want to place it over to kind of soften up the skin and the beard if you're going to be shaving them. So you kind of lay that on there, and you're going to tell them you need to verbalize how long you're going to do that for. Just tell them, like, I need to put this on there for a couple minutes to soften the skin up. So when you do that, you leave that on for 5 minutes, and then you're going to take your shaving cream. I'm not actually going to put it on my face, but you're going to take the shaving cream. You're going to put it on the resident's face, whatever needs to be shaved. And then you're going to use your disposable safety razor. Ours look like this. I'm not going to actually take the cap off, but you're going to do that, and then you're going to make sure you pull the skin kind of tight with the hand that you're not going to be shaving. And then you're going to do long strokes down in the direction of hair growth. So you're going to do long strokes around the longer areas of the face, like through here and up through here. Now for the chin and right through here, you're going to want to make sure you use short strokes like that, not long ones. And then you're going to make sure when you're shaving their face that you're rinsing the razor off often, because you don't want to leave a bunch of shaving cream piled up because you won't get a close shave. After you do that, you're going to want to use your washcloth and just get any of the remaining shaving cream off their face. And then you're going to want to pat the face dry with another towel. I didn't bring another one in here with me. Let's pretend this is my towel. You're going to want to pat dry their face with another towel. And then you're going to make sure you want to observe make sure you check for any kind of nicks, cuts, any irritation, bleeding. And if there is, you want to apply pressure to that for however long needed, and you want to note that. And if there is no nicks or cuts or anything like that, you can apply aftershave or lotion. And then after that, after you get the lotion on, you're going to want to make sure you observe any kind of nicks, cuts, whatever. And you're going to remove and dispose, you're going to remove the towel off the resident. And then you're going to want to make sure you dispose of dispose your gloves. And then you're going to want to raise your bed rails back up, lower the bed back down to its lowest position, and then lower the rails back down because you can't leave all 4 of them up because that's restraint. So make sure you get the bed back in order, check in lowest position. You'll make sure you attach the call light within the resident's reach, and clean and return any proper equipment the way it needs to be stored, and make sure your razors, the disposal ones, go into your sharps container. And wash your hands and report and record any observations, like for nicks or cuts or anything you might want to tell the nurse. Now we're going to move into the nail care. Our unit where I work at, they don't have this stuff down here because it's a psych unit. We don't have the nail care stuff, but I'm going to go through it, but the best I can and explain. So you're going to need an emery board, which is your nail filer, your orange stick, nail clippers, and a kidney basin, and we'll say the bath basin. That's what we're going to use for this. And you wash your rag or paper towels, and you're going to come in and you're going to knock, identify and greet yourself, explain the procedure to the resident, and provide privacy. You're going to want them to soak their hands in warm water for about 5 to 10 minutes. And then after you do that, you want to clean out I don't have an orange stick, but let's say my pen here is my orange stick. You're going to want to clean out from under their nails, get any kind of dirt out from under them. And then after you do that, you want to clip the nails, but you want to make sure when you clip their nails, you go straight across. And make sure you file the edges. I don't have a nail filer, but say this is my nail filer. I want to file the edges of the nails. And then after you do that, you want to take your cuticle board, the flat end. Don't have one of those down here. And say my pen again is my cuticle board, and you're just going to push the cuticles back. And after you do that, you're going to wash your hands, perform your hand hygiene, clean and dispose of any equipment, anything that needs to go in sharps, and make sure your call light is within reach, and record observations. Now we're going to go into denture care. We don't have the things on my unit either to do denture care, but you know that you need their little container that you put the dentures in, and then you need toothbrush, toothpaste, and then the little tablets that you put in to soak their dentures. You don't want to clean the dentures while they're in their mouth. You want to take them out and make sure you get toothbrush, toothpaste, and you want to brush around the teeth and all the little nooks and crannies and crevices. You want to just make sure you brush them really good. And when you do that, you make sure you put a paper towel down and you use a kidney basin to clean and scrub them in. Because dentures are very expensive, so you don't want to drop them or anything. They're real expensive, and you don't want to get them dirty, of course. So make sure you lay your paper towels out and have your basin, and make sure you brush the dentures good. And then you're going to want to get cold to lukewarm water, because with dentures they can warp really easily, so you don't want to put the dentures in hot water. You don't want to do that. So when you get the dentures brushed and cleaned, and after you do that, you want to put the dentures into the cold to lukewarm water, let them soak as needed. You're going to make sure you put the call out within reach of the resident, and Make sure you report and record any observations. And the last one I'm going to move into is care for an unconscious person, oral care, which is very important for people who are unconscious because their mouth gets dry and you need to perform that every 2 hours. And for that, we don't have really the stuff for that down here either, except for the little sponges. But you're going to knock, and even if they're unconscious, you still act as if they can hear you, because people who are unconscious can still hear things. So you want to make sure you come in and identify, greet yourself, explain every step of the way what you're going to be doing. And they shouldn't have dentures in, but you're going to take and make sure that you brush their teeth really good. And make sure you get the tops of their mouth, their tongue, the gums, teeth, everything in the mouth. You just want to make sure you get it cleaned really good. And you don't want to let them swallow any water because you know they're unconscious, so you have to be kind of careful about that. You still explain every step of the procedures. I know when we've done oral care here, we use these little sponge sticks and a mouthwash, different kinds, I guess, different preferences. But you can just take your sponge, your clean, and make sure while you're doing this, you're wearing your disposable gloves. I forgot to mention that. And make sure you're performing hand hygiene before you come in and do any of this. And you're going to take the sponge and your mouthwashes and make sure you do a rinse real good and get through here and up in the roof of the mouth, the tongue, and just make sure all of that is good and clean and that you don't let them swallow any water or anything. You just got to be real careful because it's an unconscious person. And you also, I forgot to mention, you want to make sure you are identifying your residents when you do any of these steps. And just make sure that you dispose of any equipment properly, any sharps, and make sure when you take your gloves off, you perform good hand hygiene. Make sure your bed check's in lowest position, call outs within reach, and report and record any observations.